Hi, everybody. This is Dr. Mary with 4 Points Family Chiropractic. If you don't know us, where we're located, we're in Northwest Austin. And I am here today on this chilly here, Austin day, to talk to you a little bit about walking and how it can benefit your health, and how to kind of design it in a way that's best for you. Walking often gets dismissed as something that we just kind of do day to day. There's no real benefit to it. It just gets you from point A to point B. Beg to differ. There's a lot of really, really good research out there and anecdotal experience that lets us know that walking is one of the best ways to support your health. So, there's several different parts of your health that benefit from walking, and the physical one's kind of obvious, but I'm going to talk about it anyway. But I actually want to start first by discussing the mental health part of it. So walking is a really good way to reduce your stress and anxiety. When we talk about the nervous system, that kind of fight or flight sympathetic response, it actually responds really, really well to walking, because getting the movement in your body and in your joints gives proprioceptive feedback to your brain that helps calm you down. So often patients, when they're stressed out, if they go and they walk for a little bit, and I do this too, if I just walk, it actually helps a lot. So just do like a 5 to 10 minute walk when you're stressed, and it'll help bring your stress and anxiety levels down. There's a great study in 2020 from the Lancet that found that regular walking, like regular, daily, every other day, lowers your stress and anxiety, because it also promotes an endorphin release, which is really nice as well. I've also seen that walking can kind of mimic the EMDR, the rapid eye movement that calms your brain down as well. So that's a really good benefit. It also boosts your mood and your cognitive function. So that's some research out of JAMA that depressive risk is actually decreased when you are walking, because there's more blood flow, not just to your heart and your muscles, but also to your brain. And it also enhances your creativity and your problem solving. And that's one of those benefits that to me was not obvious, but it was really interesting to learn that so a lot of us are just like distracted by screens all the time, or we have background noise constantly. When you get out and you move your body like that, when you do things like walking, so it's not high intensity, you can kind of turn the part of your brain off that tells you what to do. You're just moving. It actually helps the creativity part of your brain switch on. And compared to just sitting, it boosts your creative thinking by up to 60%. So if you're feeling stuck on a project, you're not sure where to head, besides chatting to somebody, just go and take a walk, because it'll accomplish that for you. Now, the other part of the health that it really, really benefits is your cardiac health. This gets talked about more often. It's probably going to sound very familiar to you. Walking does two things. It increases your cardiovascular health by reducing your risk of heart disease, which is great. It gets your heart to work at kind of an even higher intensity level. Now, weight training is also good, high intensity, but a lot of people can't do high intensity quite yet, because either their bodies don't allow them to due to injury, or because they don't want to do too much, or because they don't have access to things that'll help them do high intensity. But pretty much everybody has access to a place where you can walk. So if you do that, you get out and move your body, you're automatically raising your cardio threshold. Now, it also lowers your blood pressure and your cholesterol level. So if you're somebody who gets their blood work back, and again, the doctor's like, I don't love your cholesterol numbers, your LDL's a little bit high, then it's just your tail. The brisk walking for 30 minutes a day actually reduces hypertension and LDL, and that's from a 2020 study out of Circulation, which is a cardiovascular journal. They do research on that. Now, of course, for a chiropractor, one of the biggest things we look at when we talk about the health benefits of walking is for spinal health. If you're a patient in our office, you know that we ask you to walk for 5 minutes every time you get adjusted. Part of it's muscle memory. We got to get your muscles to start working together. Another big part of it is the discs. So the discs are the cushion in between the vertebra, and it's actually what protects the nerve from any bone pressure. So that disc in between needs to be very thick. And when there's a subluxation, that starts to thin out. When we adjust you back to the correct position, it pumps and you get more disc health. And that's supported very, very well in the research. The most recent I found was from the European Spine Journal in 2021, that walking increases your spinal disc hydration, but also the flexibility. And it is soft tissue, so we want flexibility in that as well. Walking also, in terms of your spine and your general health, supports core strength. Again, it doesn't seem like much, but it does. In order to walk appropriately, you have to engage all of your core. Remember that it's a cube. So your diaphragm, as your lungs expand and contract, that's working. Your pelvic floor is working to stabilize you. And then the obliques on the side, and then your abdominal muscles and your back muscles. So all of that has to engage for you to walk appropriately. It is one of the easiest core exercises that you can do. And you can make it more difficult for yourself, and I'll tell you about that in a couple of minutes. But making sure that you're walking is one of the best things you can do to support your core, and just make sure that the discs and the ligaments stay flexible. Now, if you're somebody, or you know somebody who's having issues walking because of back issues, like sometimes a low back or a neck will have issues doing walking for more than a few minutes, that's something that we treat all the time. So if you know someone who's suffering from that, they can reach out to our office. Our number is 512-345-9355. If they mention this Facebook Live or walking, then they can get a full exam, including any necessary orthopedic, neurological testing, necessary x-rays, consult with a doctor, and a review of findings. It's normally $348, but if they mention this Facebook Live, they can get it for $97. It's a great way to just come in and get checked if you find that walking is something that you're not able to do, or you're limited to it, or you want to make sure you're not at risk for any damage when you do, although most people aren't. So those are the health benefits of walking that we see. Sorry, I'm trying to work around a cat here with my notes, that we'll see patients get to benefit from, and ourselves, right? Now, how many steps do you really need to get a day? So one of the things that you will probably hear time and time again is shoot for 10,000 steps a day. That has been conventional wisdom. It is out there in the world. And I have some news that was just really, really good marketing. The 10,000 steps a day actually originated in Japan sometime in the 1960s, and it was by a company that created pedometers, so something to monitor how many steps you took a day. And the 10,000 steps is a great goal. Like, if that's something that you want to have as your goal, by all means, go for it. And it really became popular as far as a way to maintain health. It's not really scientifically backed though. 10,000, again, it's a goal, but most research shows that about 7,000 to 8,000 steps a day is more than sufficient to make sure that you're getting the benefits. And that is strongly linked to lower risk of premature death, improved heart health, particularly in middle-aged and older adults. So if you find yourself in that range, be shooting for 7,000 to 8,000 steps a day. Now, beyond 10,000 steps, the benefits tend to kind of plateau. So you're still getting benefits up until about 10,000 steps, and then it kind of evens out. So additional steps, still beneficial, but kind of diminishing returns, not necessary. I will say intensity matters. So the intensity of your walking. If you're walking after dinner, by all means, go on a leisurely stroll, but you do want to be watching your heart rate. Now, luckily, a lot of the apparatus that we use to measure this tracks our heart. So the Apple Watch will do it. Most pedometers will do it. I have the Oura Ring, that will do it. Keep an eye on that, because the brisk walking, the kind of moderate to physical pace, has more benefit. So you can do fewer steps if it's higher intensity. Now, if you don't want to launch right into the 7,000 to 8,000 steps a day, what I tell people to do that's the best way to determine what amount of steps are best for you, because it's all very individual, right? Everyone's health is your health. Use a tracker, whichever one you want. Get an average of how many steps a day you get for about 2 to 4 weeks. Figure out what your daily average is, and then try to add 2,000 steps a day to that. So say you unfortunately are pretty sedentary, you have to sit at a desk most of the time, you walk to and from your car, and then maybe you walk around the house doing chores. So you're probably only getting like 3,000 steps a day. But that's your average. Once you know that you're getting 3,000 steps a day, shoot for 5,000 or 5,500 steps a day, and you'll see pretty quickly health benefits show up. So that's just a good way to figure out how many steps a day you as an individual should be shooting for. There's different ways to make this easy on yourself. And I say that because sometimes we'll get pushback from patients like, I don't have to, or my own self, who am I kidding? Sometimes at the end of the day, I'm like, I don't really have time. I don't want to go on a walk. The sun's already down. Right now it's cold out. Like, I'm not that interested in being outside. There's different ways to make it easy on yourself and just kind of fit it into your day. You know, a good one is park farther away from whatever you're going into. If you're going to HEB, park at the back of the parking lot. You'll get your steps in there, in the store, and on the way back. Maybe your office has a garage close to the office and then one farther away. Pick the one farther away, higher up. You get more steps in. It can accumulate really quickly. You might see yourself adding an extra 500 steps without even realizing you're doing it. You can also walk and talk. If I'm on the phone, I love to walk. I'm a pacer, so I kind of just work that into my life. If I have to make a phone call, I'll just walk. A lot of people now at work, I love that these are more common, but walking pads, you can get them on Amazon. You can get them a lot of places. They're pretty affordable now. They've done a lot of work to make them that way. A lot of them fold up and store easily, but you can walk at a slow pace when you're doing work. You can be working on your computer, talking on the phone, a slow pace. You don't want to get out of breath, but you can incorporate your steps that way as well. I've seen a lot of people use that and hit their step goals really quickly, and they can extend their step goals as well. I also think that breaking it up is smart. I have this habit myself when I add in a goal or I establish a new habit, I just go really, really hard on that habit. Like, it's all that I focus on, and then it'll sort of fade away. It's not a great way to start a habit. Just try to like break it up during the day. Maybe set an alarm for yourself. Make sure that every day after lunch, you go for a 10-minute walk. You know, if you're a patient in our office, you're getting 5 minutes every time you get adjusted. Just make sure you're adding in walking at kind of a gradual pace and in small bite-sized amounts. It'll make a big difference for you. And also make it fun. Maybe go with a friend. I listen to podcasts. Again, I'll make phone calls, audiobooks. You know, you can get those now pretty easily. And it's just a good way to keep your mind occupied while you're walking, if walking is something that, you know, you get bored by. I've heard that a lot too. Like, people get bored. Just entertain yourself. And then you can also make it more difficult. Leveling it up is also something. When you have an athletic past, sometimes walking seems like an insult to what you know you can do. Make sure that you're making it fit your life. So like, I've started using a weighted vest, and that's been really, really fun. Well, not fun. That's been really interesting because I can control like how much pressure it is. So if there's more weight, there's probably less walking until I work up to the amount of steps. Then I can add more weight, add more walking. That's an easy way to do it. You can do ankle weights, you can do wrist weights. Some people will pause on their walk and do like calf raises or lunges. And then, of course, as discussed before, intensity level. So you can watch your heart rate for that, or you can just vary how intense you're walking, like your speed. A lot of people will walk for like 10 minutes at kind of a lower pace and then increase their pace for 2 minutes and then back down to 10 and just kind of do like interval training with your walking. Watch your knee, watch your joints, all of that. Again, if that's something that you have concerns about, anyone can come into our office to get checked, 512-345-9355. We're in Northwest Austin. They can come in and get any necessary x-rays, neurological, orthopedic exam, a consult with the doctor. It's normally $348. If they mention this Facebook Live or walking, then they can come in for $97 and get checked out. And that way we can make sure that they're cleared for walking, although most people are. It's also a really good way, if you're in our office, you've probably heard us talk about it, to improve your posture. Walking by nature, again with the core engagement and keeping your posture up, will help improve your posture. Now, it's something to be cognizant of. A lot of people, when they work at desks, they kind of do this, they roll in. It's easy to translate that into your walking. So when you start doing it, make sure that you got your shoulders back and you're looking up, because that's going to help your posture overall. That trickle-down effect is very obvious. And then, you know, making it mindful and incorporating strength training. Again, you can do weights, you can do exercises, but just make sure you're aware of what your body's doing. It's really something I encourage all of people to add in. Even if you're only doing it 3 days a week, doing dedicated walking time, make sure that you're doing it, because it's really, really good for you. And the trickle-down benefits are just remarkable. So this is Dr. Mary with 4 Points Family Chiropractic. Thank you for tuning in. If you have any questions at all about walking or any of the techniques and tips that I've shared, just drop a comment below. We're happy to answer them. And thank you again for tuning in. Everybody stay warm in Austin.